Uterus, it is a very important organ. Why? Because it helps in menstruation, implantation of the fetus, growth and development of the fetus. Okay, so it is a very vital organ. So let's start to discuss about uterus. First, coming to the position, measurements, its relations, we will study about it. Okay, position, measurements, relations, structure, blood supply, as well as the lymphatics. So let's start. Coming to the position, see, you see here, this is the axis of the body of the uterus. Okay, and this one, it is the axis of the cervix. So the angle that is made by the axis of the uterine body and axis of the cervix, this is called as angle of anteflexion. See, this is the angle of anteflexion. Okay, which is 120 degree. And this one, what is this? This is the axis of the vagina and this is the axis of the cervix. The angle that is made by the axis of the cervix and axis of the vagina, it is called as angle of anteversion. Okay, which is 90 degree. See, this one, here you see angle of anteversion and angle of anteflexion. Okay, so let's write it down here. First, position of the, let's write something about uterus. Okay, it is a hollow, it is a hollow pyriform shaped muscular organ which is situated in the pelvis. Pelvis that helps in what? I told you, menstruation, then fertilization, not fertilization, implantation. Okay, implantation, it helps in implantation and growth and development of the fetus, growth of fetus. Understood? Okay, so what is the position? Position is anteverted and anteflexed. Anteverted and anteflexed. Okay, what is the importance here? What is the significance? It is anteverted and anteflexed. So this is the pelvic floor. Okay, so if it will be straight like this, if it will be straight, so directly it falls and the occurs prolapse. If it is anteflexed and anteverted, then it prevents from prolapse. Okay, then coming to the measurements. What is the size of the uterus? First, 3 into 2 into 1 inch, that is 8 into 5 into 1.25 centimeter. Okay, what else we have remembered as 3 into 2 into 1? That is size of the ovary. Size of ovary. But this one is in centimeter. 3 into 2 into 1 centimeter is the normal size of ovary. Okay. Then what is the weight of non-gravid uterus? It is 50 to 80 grams. Okay. Weight, it is 50 to 80 grams. Then coming to the relations. See, I have shown you in the first diagram itself what are the relations of the uterus. I am showing you again the sagittal image of the sagittal section of the female pelvis. See, this is the uterus. Okay, here. This is the uterus and this is the fold of the peritoneum. This is the posterior fold and this is the anterior fold, which is called as vesico-uterine pouch, and posteriorly it is called as pouch of Douglas or recto-uterine pouch or pouch of Douglas, which is present posteriorly. So what are the relation? Anterior to the uterus there is presence of bladder, and posteriorly the intestine and pouch of Douglas. So let's write it down here. And laterally, the ligaments are present to support the uterus. See. So now coming to the parts of the uterus. Okay, parts of uterus. Parts of uterus. Let's draw a diagram here. See, this one is the uterus, this is the cervix, and this is the fallopian tube. Okay, I'm very poor in diagrams, so just for making you understand. Okay, so let's see, this is the uterine cavity, and here is the vagina. Okay, so what are the parts of uterus? Here, see, this part, this is the upper part where uterine cavity is not present. This is the uterine cavity. Okay, so uterine cavity where it is absent, this is called as fundus. This is the dome shaped structure where the uterine cavity is absent. This is called as fundus. And here, this is the part of the uterus that contains the uterine cavity. This is called as the body of uterus. Okay, then coming to the cervix. This is the cervix. Okay, this is the ectocervix, the part that lies inside the vagina, it is called as the ectocervix, and the part that is present, this is the inside, it is called as endocervix. Fine. Ectocervix and endocervix. Okay, so this is the cervix and this one is the vagina. Then what is the isthmus? This is the cervix. Okay, this part is called as the isthmus. What is isthmus? It is the part between anatomical os and histological os. This is the internal os. Okay, this is the histological internal os. Histological os. This is the anatomical internal os. So the part between the anatomical internal os and histological internal os, it is called as the isthmus, which is 0.5 centimeter. Okay, fine. Then, what is corpus of the uterus? It is very confusing. What is corpus of the uterus? What is fundus of the uterus? What is body of the uterus? Corpus of the uterus, it constitutes both fundus as well as body. So, corpus means both body and fundus. Collectively, it is called as corpus. Also, body of the uterus is alternatively, you can call it as corpus. Okay. Then, so parts of the uterus, let's write it down. What are the parts? First, body or corpus. Okay. Then second is fundus. Third is isthmus. Then fourth is cervix. So these are the parts of uterus. Okay, fine. Then what are the relations? See this one, you see this is the fundus. See, dome shaped structure that has no uterine cavity. This part is the fundus. Okay, this is the uterine tubes. Okay, this is the uterine cavity, which is the body of the uterus. This, and then here it is the supravaginal portion of the cervix. Okay, this one. Then this is the vaginal portion of the cervix. Okay, and the part between anatomical os and histological os is the isthmus. Okay, fine. Then this is the cervical canal. This is the uterine myometrium, and this is the parametrium. Okay, understood? Okay, then coming to the relation of uterus. See, there are presence of structures which are present anteriorly, and some structures are present posteriorly, and then some structures are present laterally. So anteriorly, what are the structures that are present anteriorly? First, it is the bladder, urethra, and vesico-uterine pouch. Okay, vesical pouch. Then posteriorly, what is present? Pouch of Douglas. Okay, pouch of Douglas. Then laterally there is the ligaments. What are the ligaments? First, see, I'll show you with a diagram. See, this is the uterus. Okay, this is the fallopian tube, and here there is presence of McIntosh's ligament, which is present laterally. Where? Laterally presence of, this is also called as transverse ligament or McIntosh's ligament. Okay, here laterally there is uterine artery, okay, which supplies the uterus and descends downward, and presence of ureter. Okay, This is the macrandroid ligament, this one, green color. Okay. Then transverse ligament or macrandroid ligament. So this is the first macrandroid ligament. Then second, what is second? It is levator ani and bulbocavernosus muscle and vestibular glands and Bartholin glands. Vestibular bulb and Bartholin glands. Bartholin glands. Okay. So here we complete the relation of the uterus. That is, anteriorly we have bladder and then urethra, okay, and vesico-uterine pouch, that is the fold of the peritoneum, and posteriorly we have the pouch of Douglas, and laterally we have the ligaments, that is macrandroid ligament and levator ani muscle. Levator ani, it supports the uterus, okay, it is a primary support of the uterus, levator ani as well as the macrandroid ligament. Both are the primary supports of the uterus. So they are present laterally, and bulbocavernosus muscle as well as presence of the Bartholin glands and vestibular bulb. Then coming to the structure. What is the structure of the uterus? It is a muscular organ. So consists of parametrium. What is parametrium? It is a serous coat, okay, which is present all over the uterus. It invades all over the uterus except laterally. Okay, this is serous coat. And then myometrium. Myometrium, it is the muscular bundles. Okay, muscular bundles that are present in interlacing manner. Interlacing manner. Why? Why it is present in interlacing manner? Because during it is present like this, interlacing manner, so that the arteries that are present in between, okay, it will act as a living ligature. That is, it will compress the interlacing manner of the, see, let this one is the artery and this is the crisscross or interlacing manner of the muscular bundles of the myometrium. So this is the artery, it is present, and after the delivery the placenta is expelled. Okay, this is the artery and this is the uterine muscle. So it will help the interlacing manner. In interlacing manner, it will help to compress the artery so that the bleeding is stopped, or the sinuses which was open previously, it will be closed. Okay, so that is why it is called as living ligature. Okay, it helps in achieving hemostasis, decrease blood loss after delivery. Fine. Okay, then next it is parametrium. First is parametrium, then myometrium, and then third one is endometrium. Everyone knows about endometrium function, what it does, if hyperplasia occurs, what to do. Okay, it is very important structure and it helps in implantation of fetus, implantation of blastocyst. Okay, so it is a blastocyst. It is a lining of the uterus, inner lining, which sheds during menstrual cycle. Okay, then coming to the next part, what is the blood supply of the uterus? It is very important, blood supply. So what is the major blood supply? Majorly it is supplied by the uterine arteries. And what is the uterine artery? Is a branch of anterior division of internal iliac arteries. Okay, uterine artery, majorly it is supplied by the uterine artery, which is a branch of anterior division of the internal iliac arteries. And then secondly, it is supplied by the ovarian artery and utero-ovarian anastomosis. Okay, here the anastomosis supplies the lateral part of the uterus. Okay, and uterine artery, ovarian artery, and utero-ovarian anastomosis. Okay, what is the lymphatic drainage? Just remember this part. Lymphatic drainage. Lymphatic drainage of uterus. First, pre-aortic, lateral aortic, superficial inguinal lymph node. Okay, then external iliac groups. These are the 4 lymph nodes that majorly drains the uterus, that is pre-aortic, lateral aortic, then superficial inguinal lymph nodes and external iliac group of lymph nodes. So, thank you.